Hi, I'm Lynette Kane. I'm Director of Quality at People's Community Health Clinic, and I'm here to talk to you about colon cancer. It is preventable and treatable, so please get screened. Colorectal cancer is cancer that happens in our colon when the cells multiply really fast and don't die when they should. And then this can create a mass of cells known as a tumor. And in the colon, another name for the tumor is polyps. And always remember, colon cancer is preventable and treatable if found early. Current guidelines state that people between the ages of 50 and 75 are at higher risk. There are some new recommendations coming out that people age 45 and older should be screened, but insurance companies have not adopted that, so they will not pay for it. If you have a personal history of colon cancer in the past, or any of your family members have had colon cancer, that's another reason to be screened. If you're also experiencing any of the following symptoms of constipation and diarrhea, or a combination of constipation, diarrhea, any changes in your bowel movements, do you poop more often than normal or not as often? Do you have any bleeding from your rectum or blood in your poop? If you have bloating, cramps, or a lot of discomfort in your abdomen, and also if you have a feeling of after you've had a bowel movement, you still feel like you have to go more, those are symptoms that you should report to your doctor and let them know so that you can be screened. Some screening options are the FIT test. That is where you have small amounts of your poop, where you scoop it and then you put it in a tube, take it back to the provider's office. This test screens for hidden blood in your stool, and then it can be done in your own home. You don't have to do it at the office unless it's easier. It is easily collectible. A Cologuard, that is a kit that's mailed to you where it's like a little hat that you put on the stool and you have your bowel movement into the hat. You box it up and send it back. This test can also be done in your home. A colonoscopy is done at the hospital or a specialty office. That's where the colon and rectum are looked at through a scope that's inserted through your rectum, that the doctor can look to see if you have any polyps. One of the downsides to this that patients say is you have to prep for this, meaning you want your colon totally cleaned out. So you have to drink lots of fluids, and then you have to take a liquid laxative, and that you start it the night before, and then you spend a lot of time in the bathroom just cleaning your colon out. And one of the best reasons to have this test is it takes a look at your entire colon to see if there's any polyps. CT colonography, that's called a virtual colonoscopy, and this uses x-rays to kind of see your colon where you lay on the table and then you rotate, you kind of turn around and they take x-rays of it. If you have a FIT test, that should be done once a year if it's normal. If it's not, then you need a colonoscopy. The Cologuard is done every 3 years. If normal, if not, you need a colonoscopy. The colonoscopy, once you have that done, if it's normal, majority of the time it's done every 10 years. If it's abnormal, you have to have it repeated every 1 to 5 years. The CT colonography is done every 5 years if it's normal. If it's not normal, you have to have a colonoscopy. Here at People's Clinic, we will give you a $10 gas card for completing the screening. If you do a FIT test Once we receive your stool sample, we will mail you the gas card, colonoscopy, or the Cologuard, or the CT. Once we get those results and know that you've had it done, we will mail you the $10 gas card. Or if it's really important that you need it for transportation immediately, we will give it to you once we have those results. If you have a high copay with your insurance or no insurance at all, we will help you pay for the screening of your choice. If you're a patient here at People's Clinic or would like to become a patient of ours, just call our main number 319-874-3000 and ask for an appointment with your provider. If you do not come to People's Clinic for medical care, call your provider and tell them you want to get screened. So just remember, it is so important to be screened. Colorectal cancer is preventable and treatable if caught early. So please get screened.